Hi everyone, a very good afternoon to those who've joined us for the session today. As always, I'm Shivani Roy. I am your webinar host. I work for the marketing team at LeadSquared, and since this is a LeadSquared webinar, I'm just going to do a sales pitch very quickly. LeadSquared is a healthcare software which provides exceptional patient experience to acquire, engage, and retain more patients. So thanks so much for joining this session. We'll be discussing navigating the patient journey in a digital world. Some of the things that we'll cover today are digital transformation of care, the continuum of care and journey transitions, care access and care experience, friction-free care journeys. So to take us through that is Mr. Vivek. He is the co-founder of humanfractal.ai. They provide digital tools and building blocks to craft and execute a data-enabled health journey for the providers. So it also includes pre-care, care delivery, post-discharge care through a care journey platform. Thanks so much, Vivek, for joining this session. Please do share a few lines about yourself and take the session forward.
Okay, yeah. Thank you, Shivani. Good afternoon, everyone. Thank you for joining the webinar on navigating the patient journey in a digital world. I'm Vivek, co-founder of humanfractal.ai. We are a 3-year-old digital health company based out of Bangalore. I'll give you a quick brief on what do we do. So we are a health journey platform. The core ethos of the company is we enable people to achieve health outcomes. Okay, and we run journeys across wellness, prevention, and therapeutic areas. I'll give you a notion of what a journey is in the upcoming slide. But from our perspective, we do two things. We craft and run our own journey around wellness, and we give the tools and necessary components for the ecosystem to craft their journey on our platform, mostly providers, hospitals, and individual consultants. So on the bottom, you could see the range of journeys, the most popular journeys that are running in our platform now. The one around scientific weight loss, optimized sleep, running performance, and workplace performance, which is mostly targeted at the corporates for corporate wellness and engagement. And post-discharge journey is one of the unique journeys that we run for patients who just got discharged out of a procedure or a treatment. And children's health journey, that obviously a growth journey that we run with few pediatrician and school customers. So I'll give you a brief on the construct of a journey. Okay, this is from our perspective, what a health journey should look like. Every journey should have a goal orientation. It can be as simple as improving your sleep to managing your diabetes, recovering from a procedure or a treatment, and things like that. So the second notion of a journey is always there needs to be hyper-personalized pathways, because the baseline that I start will be completely different from someone else. And again, one core principle with us is it needs to be hyper-personalized, and it needs to be data-driven as well. So a journey should always be informed by data, including health and wellness data. And a journey is nothing without any interventions or recommendations, but it needs to be evidence-based. So most of our journeys are all evidence-based, backed by science and solid evidence library. And the recommendations can be super good, but it needs to instill user action. So there needs to be a good amount of behavioral science need to be embedded into any health journey, so that people take action and they comply on the recommendation or a treatment pathway, and then so they get results. Okay, and another important thing in a health journey that we observed is there needs to be a brick element to it, because there needs to be a touch point. It cannot be completely digital, because some elements of health will always be physical, but the journey needs to intervene both digital and physical experience. And when we do all this, there is an orientation towards outcome, both subjective and objective outcomes. What I mean by subjective is the individual subjective feeling of getting an outcome like feeling better, having good energy levels and things like that, to objective that a particular health outcome is achieved, which is measurable, like your cholesterol is optimized, your biomechanics is perfect, and things like that. And another important thing is few journeys need to be autonomous, like what LeadSquared doing with marketing, because there needs to be some intelligence built into a journey. And we also should have human in the loop. So most human faculty journeys is augmented by AI, but that will be practitioners, that will be clinicians in the loop, who run and execute a particular journey. So a little bit on the interventions. Most of our journey has all these interventions built into it. So we built a massive intervention library, which includes like 800 plus interventions across all these pillars. For example, take a simple thing like obesity, like weight loss. I need to take care of my nutrition. I need to exercise. I need to change my lifestyle. I need clinical intervention also. But think about another performance area like running. Again, I need to make sure I am clinically qualified to run, that I don't have any pre-existing condition. I need to fuel my run. I need to make sure I don't get injured while I run, so that my movement quality needs to be good, my running form needs to be good, and finally comes running skill. So we are like a Netflix of evidence-based library, and the wellness techniques will be pulled by AI depending on a particular journey, and always augmented by a human in the loop. So how big we are? We have like 1 lakh customer journeys that we are running now, and 20 plus corporates working with us on workplace performance, and 15 plus hospitals in India, and also abroad running our care journey platform. And I promise you, I mean, there is no more talk about human faculty anywhere going forward in this webinar. So the upcoming slides on all these 4 areas is based on our understanding of Indian healthcare market, on what is happening, observing that at both at macro level and also on the ground, what is happening and how do we optimize that and also attempt to transform it digitally. So we all know that healthcare is in a transformative moment. Okay, so if you could relate all the upcoming slides with little bit on the personal level as well, most of us would have experienced what's happening in healthcare. The out-of-pocket expenses are skyrocketing, and most of us will have insurance, but bulk of the India is still uninsured. But a lot of schemes are coming up, but still healthcare is an out-of-pocket experience for most of us. And most of us are infuriated with the worsening experience. It's not getting better at all, right? It's very rare people say, yeah, I have a fantastic experience sitting at a clinic or a hospital or having an encounter with any of the specialists. And outcomes, that's another important area, not just the clinical outcomes, but financial outcomes also. And with the quantum of money being spent, the outcome is still poor in multiple areas of healthcare. Okay, so based on our understanding on what's happening at the macro and the ground level, we are seeing few catalysts that is fueling the digital transformation of health. Okay. It's the right time. When we started 3 years ago, people said we are too ahead of time, that we are not ready for these kind of platform or a digital health company and stuff. But we are in a transformative moment where a few catalysts that is fundamentally transforming the way the health is experienced and we are delivered. So the first thing that we're noticing is consumer expectations are at a tipping point. Okay, people starts comparing the healthcare experience with what's happening in e-commerce, food tech, travel, entertainment. Example, I order something, I should be able to track it, and it gets delivered with a stipulated time, sometimes ahead. The payment experience is smooth, the rating experience is smooth, and even the discovery is smooth, right? So people are expecting the same experience that they're experiencing in the other industry verticals to healthcare. Another important thing that we are seeing is the rise of self-quantification and self-care. Leave the non-evidence-based medicine aside, all the alternative medicine aside, but Fundamentally, people are self-calling diagnostics. Okay, India is one of the biggest market for direct-to-consumer diagnostics. People just go out and just run their own test and see what's happening with them. Okay, and people buy wearables. People measure their heart rate. People and the rise of fad diets. Okay, people just do keto diets on their own, and so many other things. And self-care is, I think, fun. I think it's already been experienced by most of us. And the second catalyst that you're seeing is the emerging modalities of care. Okay, there are new sites of care that we already seeing there. If you live in any one of the popular Indian cities, the home care has been already popular, at least in Bangalore, Chennai, Bombay, and most of these cities, right? And a lot of retail experience-based clinic have already started coming up, and workplace clinics, and a lot of companies in India start setting up clinics at their space, the primary care clinics. And also, we are also seeing virtual care clinics where you just download an app and you could consult a doctor within a few minutes. And also, there are a rise of the specialty networks, okay, for each and every therapy area or a disease area or a health area. You started seeing clinics coming up or hospitals coming up, child care, think about pregnancy, think about thyroid clinics and obesity clinics. There's a lot of specialty networks that's been coming up. But again, the fundamental problem is the experience is still fragmented because the referrals are still offline. The discovery is offline through word of mouth and things like that. Even though I have a broad set of care sites available to me now as a consumer, I don't have the health data portability because there is no data at all, right? So that's the catalyst 2. And catalyst 3, the other digital building blocks are maturing. If you see phones are perfect, connectivity is perfect, broadbands are perfect, and other layer 2 components like video streaming. I think we have a seamless experience in terms of entertainment and content consumption. Payment, I think we are actually leapfrogging other countries in terms of the availability of different payment modalities and stuff. So the enabling services are pervasive. It's a friction-free experience and stuff, but again, the core issue is no health data and no liquidity at all, meaning the data doesn't move anywhere. Because I do a test, and personally, we can relate it to all of us. We just do a test and we just keep it with ourselves. And the next time we go for a test, we don't even know where the old reports are. And even though if it's a PDF, there are some people I've seen charting the data and then tracking their longitudinal data, but most of us still doesn't do. So there is virtually no health and wellness data, and it's if it's there, it's in silos. Hence, they are in silos. There is no liquidity on the data. So we believe this is the right time for digital technology to accelerate the transformation. This time it's going to be different. But another important warning is we are not going to see the same effect like happened in the other vertical. Like it's not going to be a marketplace that is succeeding, meaning like what happened in the e-commerce, what happened in the other thing. I mean, you are not fundamentally going to see thousands of vendors and then you pick and choose. It's not going to be that way. But fundamentally, the way we access care, the way we experience care, and the way we pay for care, and the way outcomes are delivered is going to be fundamentally different this time. Okay, so a little bit on the continuum. Again, related to a personal level, most of us will start with an optimal health and then we'll be like just okay, and then slowly we drift into a disease state. Okay, so this is from our perspective. Again, when you look at many health systems, they have a different way of putting the health continuum. Believe me, no one just jumps from wellness to disease overnight. Okay, it doesn't happen overnight, except you have some terrible genetic makeup or some acute situation happens. For bulk of us, it's a choice of lifestyle, it's choice of nutrition, it's choice of other environmental factors like toxicity, pollution, and things like that, and no activity and things. Is mostly a lifestyle choice and a few other things to it. So the lifespan is already extended, so it's guaranteed. So we already see that in the real world that most of us whom we personally know are breaching beyond the age of 80 and stuff. But what's important is we know that lifespan is getting extended, but what about the health span? Are we operating at our best optimal health during our lifespan? So the health span extension is the game. Because if you see the bulk of the strain on the health system is around the non-communicable diseases, including obesity, diabetes, cardiac care, and COPD, and things like that. So how do we transform it fundamentally? So this is where we believe digital tech will play a pivotal role. Okay, so when we are in a dysfunction state, that's what we mean by the preventative health. I need to, for example, personally, I need to do my health check every year, and I need to start acting on it. Okay, so if I discover myself that I'm in a dysfunction state, or simple things like body composition, I'm on a trajectory of gaining weight, I need to work on it before I get into a disease state. So bulk of the things are preventable, and this is where we believe digital interventions will play a pivotal role in partnership with the clinicians, in partnership with the providers. So how does these journey transitions happen from the digital perspective? Okay, so the first thing we all need to understand is the health status is dynamic. Okay, meaning I won't be in a same state of health.
Vivek, we lost you there for a bit. This whole section, just in this slide, we couldn't hear the initial bits.
Oh, is it? Okay, the journey transition slide?
Yes, yes.
Okay. So the fundamental thing that we need to understand is the health status is dynamic, meaning all of us will be fluctuating when we look at certain parameters of health, right? For example, say I don't eat clean for like a couple of weeks, or I don't do any activity for a month, or I'm into alcoholism, or I'm traveling through a zone of high pollution, things like that. The status is dynamic, but some of the variables will have an immediate impact. Assume I'm already in a disease state. Like I have diabetes, but I don't take my medications on time, or medications in a proper way. So my risk keeps varying. So we call that as a dynamic risk trajectory. Okay, this is again based on data. Without data, you cannot do anything. So fundamentally, there are some mechanisms emerging to do a longitudinal health scoring. Okay, today I'll stay at some score. The next week, my score might change because of the lifestyle exhaust that happened between today and the next week. Or I may have a pre-existing genetic condition itself. So there's a lot of variables that go into the scoring. So the transition between a wellness journey to a prevention journey to a therapeutic journey happens using these scoring mechanisms. Okay, I'll talk about how it happens from a systems perspective in the next slide. But this is all we need to understand. Assume I'm going for a knee replacement surgery, and we have a post-discharge journey for that. I may need to take some medications. I may need to take care of my surgery site. I may need to take care of my nutrition. I may need to do some physiotherapy exercises to recover. Okay. Once I've done, I'll again slowly drift back to a wellness state. Okay, so those are the things. Just give you a real life example. So there are companies which are going out and proving that diabetes can be the remission is possible. Okay, a lot of Silicon Valley companies have started doing that. So, but still, I have a risk of diabetes reappearing. So it's always dynamic. It always requires a lot of data, but at this scale, we need to do a lot of automation to make sure I am aware of my health status and which part of journey that I'm drifting. Okay. So how do we enable that from system perspective? Okay, we all know from the system taxonomy perspective, there is a system of records, system of intelligence, and system of engagement. Okay, the record, that's where the problem starts, but there's a lot of efforts globally that's happening to consolidate our health record, wellness record, our environmental data, our behavioral data, I think we've gone overboard on behavior alone, but there's a lot of other data that we need to consolidate to create a system of record. On top of that, there needs to be a system of intelligence that we call the medical grade algorithms to look at our risk. Okay, to look at our risk. For example, I can give you a simple example that we use in human fractal, like everyone, we give them a score on obesity risk, their diabetes risk, their heart score, and things like that. Okay, so these needs to come from a global evidence pool of algorithms, which needs to be validated. And also there are some categories emerging on the technology side. For example, FDA has started giving something called a software as a medical device. Okay, no more the medical device needs to be in a physical form, as software still can be a medical device. It can inform, it can help you manage a condition, or even in the future, it can treat a condition. Okay, different level of compliance, different level of regulations and things like that, but still there's a lot of algorithms that is emerging. And then there is a workflow engine which puts us in the connect us with the right care providers to make sure we action our health data. And finally, it's all about consumers, right? So on the top, there needs to be systems of engagement that I need to do what I'm supposed to do, because it's in the hands of consumers. Okay, so assume I'm supposed to see bulk of the prescriptions. Okay, most of them go even unfulfilled, because people don't buy the meds at all, and a lot of medicines people don't even complete a course. A classic example that's been given in India is on the antibiotics. People, doctor gave a dose for 5, we feel better in 2 days, and we don't take for the next 3 days. And second time, it will be even worse that we go buy medications on our own. So those are the things that's been happening. So, but we need a proper system of engagement to make sure we comply the recommendations that's been given to us on the journey. Okay, and also we'll have touch points. Sometimes I need to go back and meet a dog. Sometimes I need to repeat my diagnostics. I need to get a refill of my medication. I need to do my exercise and things like that. So a lot of omni-channel touch points are there. So this is how the journey transition needs to happen. Okay, let's speak a little bit about the care access piece. Okay, as of now, how do we access care? It's all based on jobs to be done, right? I need to get my vaccination done, I'll just go. Or I suddenly got a symptom, I feel feverish, I go. It's all jobs to be done. There is no continuous engagement as such. And also, how do we navigate network? Meaning, assume I have certain condition, I need to meet a specialist. People just go through word of mouth. You would have seen that's becoming popular and popular in social media. People just stop, ask, hey, tell me, refer me an urologist, refer me pediatrician, refer me any specialist to that matter, right? And people do a lot of self-triaging, right? We just go look out for some symptoms and directly go land in a specialist store. And again, a few things, at least in a city like Bangalore, it's based on convenience and cost. Bulk of my consult choice will be based on how far I am from the clinic or a clinician. Okay, and again, cost is another major factor. But high acuity conditions like procedure or a surgery, we ask people's opinion, how you feel about a particular doctor or a hospital. And again, choices are based on the insurance that we have and things like that, right? So that's how it's happening now. But once a digital platform emerges, we believe the assisted virtual triage is going to be one of the fundamental components. Okay, there are already apps emerging which will ask you a few questions and say, okay, talk to the specialist and things like that. And it's getting popular in the UK, US, and even in India. But the main issue there is the clinical quality of a particular triaging. And going forward, it will be assisted, mediated by all our general practitioners. Okay, and you should remember about the good old days that we have a family physician. We just go ask him first, what do you do about it? And he help you to make a network navigation. And more and more for most of us who's living in the cities, our family physician will be back there or the family physician will be far away. So but digital is going to help you there because it's going to help you with the network navigation and guidance, and also the emergence of second opinion platforms. Okay, I don't just make a choice with just one consultation, but I take my data. I go talk to a few people, a few clinicians or practitioners before I start making a choice. But the digital workflows are going to make that easier, and in turn, the explosion of options. Okay, but I think we should not relate it with the again back to the choice on the entertainment and e-commerce. That's a different explosion of options. But here it needs to be little. We need to be careful in terms of the needs of the patient, the cost and stuff, because the bulk of the things are still paid out of the pocket, right? Okay, moving on to the next one around the experience. Okay, the first is I need to access care. How do I access care? And the second thing is how the experience is going to get transformed. Okay, already we are seeing a pocket of unbundled services emerging in the areas of pharmacy, because people are smart nowadays. There are some services available where you can just upload a prescription and get your meds fulfilled right at the you get cost advantage, and it's mostly driven by convenience and discounts. It's good for areas like chronic condition, okay, but acute situations still you need to rely on a pharmacy experience locally. And consults, we see lot pending the legal and regulatory issues around that, but even the consults with doctors and specialists are also getting unbundled, and a lot of services are available now. Diagnostics, that's been popular. We start seeing too many ads in the market out there that help you do hundreds of parameters for a fixed price, right? So people are, and it's popular, and disclosure from our side, we also run a site called mydiagnostics.in where we do a range of tests, including your blood biomarkers, your gut microbiome, genetics, and things like that. So that's increasingly getting popular. The services are getting unbundled from the hospital. And again, rebundling is also happening on the other side. For example, fully integrated areas. Think about full stack experience on a particular therapeutic area like diabetes, like pregnancy. So you have all the services for a particular area, plus there needs to be a digital overlay for a particular area. And going forward, also the experience around insurance and payments will get transformed. As of now, still for most of us, the cashless facilities are smooth, but still it needs to get tied into the existing workflow. Because at the reimbursement stage, still there are some issues out there, including frauds, including late payments and things like that. Once these things started emerging and become mainstream, there will be new systems of engagement that will emerge. Okay, so we'll have a better experience like we have with food delivery and stuff, right? So we know the choice. First thing is discovery. Once we discover, we make our choice. The payment is smooth, and we know it's being delivered properly, and we rate them, and so that's a kind of, and the system learns from us, and the next time you will be given with the best offer, so that it will put you into loop. I think those kind of engagement systems will start emerging once the base things in the health is fixed first, and the healthcare ecosystem is fixed first. Okay, so a little bit on the care journeys. Okay, this is a kind of platform that we deployed in a few hospital chains, and we are learning from the system on how we could give a friction-free care experience. So assume this is how it starts. I may have some symptoms. I may have some existing medical condition. Okay, so assume I have an issue with my knee. I'm having a knee pain. So the symptoms trigger a need. Okay, so this is where we believe during the pre-care stage, systems like LeadSquared is making a tremendous impact. Okay, the discoverability of a service. That I have a symptom, I'll just go search in Google or search in multiple channels before I make a decision, right? So I'll check for reviews, I'll go to a landing page of a hospital and see what they've done, how their center of excellence looks like, who are their clinicians, and what is the technology, price point, and things like that. And So in the pre-care stage, the most patients will do a self-triage, or they go for a consult, or they get mediated through their family physician. And then we do our own due diligence, right? Check reviews and things like that before we make an appointment with the hospital. So what we have done in the platform is exactly preparing a patient for the pre-care. So you need to do a lot of content activities there, because there is no good quality content out there. Okay, even a simple thing like me, so there's a lot of conflicting information, not qualified information, and people start making choices with even non-evidence-based sites and things like that. Then what happens is, during the consult stage, now all the modalities are emerging. You can do a telemedicine consult with specialists anywhere around the world, or I can just walk into a clinic. And there are some emergency situations also can arise. Okay, so that's where the care delivery phase of the journey starts. But still, it all needs to be followed by the data needs to be captured, and also the intervention data based on the longitudinal encounters need to also be captured. Then think about the outpatient and inpatient experience. Think about an outpatient experience. Okay, it would have happened to most of us. So we book an appointment for a particular specialist in a particular provider, and either we don't turn up because of traffic, or we decide, okay, we'll go later, or sometimes we go and wait like for a couple of hours before even the clinician turns up. Think about the experience there, and the wait time. But the thing is, I think, in India, we should, I think the accessibility is much more, getting an appointment is easy. It's not like a few developed economies, but still the outpatient experience itself is pretty worse here, right? So, and then we need to pay for it, then we need to wait for our turn, then we talk to the doctor for a few minutes, and then we get a prescription and we come back to the pharmacy, right? Even an integrated chain of hospital that can be handled in a much smoother way. That's why we're putting a journey platform out there. So the moment consult is done, actually there are attempts being made in few hospitals as well. So it gets added to my records, and I get my prescription, I get my advice, and then I come back and think about the next appointment. Okay, a simple thing like a next appointment. I just need to go back to the front desk, wait in the queue, and ask for the next availability, best slot available for a doctor. And the crazy thing is, in most of the cases, you just go for the next appointment. You need to explain back to the doctor on what happened in the first encounter. So things like that, even the outpatient experience can be improved tremendously, and the systems are starting to emerge for that. And think about the inpatient experience. The information asymmetry that happens, that we don't even know what is right during the pre-care stage, care stage, what I'm supposed to do, how much I'm supposed to pay, and things like that. In the inpatient experience also, okay, post surgery is done, what I'm supposed to do, and things like that. Okay, so those other things can be optimized during care delivery. And on the ongoing side, we have specific viewpoints on certain areas that we believe will be transformed by technology sooner. Okay, for example, say a post-discharge, my knee surgery is done, and I get discharged, and that's the relationship with that's where the relationship with the hospital ends. And sometimes now people start calling back their doctors on WhatsApp and stuff, but no one knows what happens in terms of outcomes, in terms of experience, in terms of compliance and stuff. So there needs to be a journey where that people are continuously monitored in terms of medication adherence, whether I'm following my nutrition, whether my surgery site is fine, when do I need to come back, if I have any questions, whom do I ask for, and those are the things. And telemedicine can be immensely useful during those situations, right? For example, the provider that we are working with, a lot of patients come from tier 2 and tier 3 towns, and they go back from a tier 1 hospital, get operated, and go back to the towns. They cannot just like that come back for a surgery, like an orthopedic situation or or a cardiac surgery. And then comes the recovery and the rehabilitation piece. Okay, every surgery requires a recovery. Every surgery requires a rehabilitation, including cardiac. We just think about physiotherapy is the only thing, but that's mostly for orthopedics. But there are other cases where I need to completely get rehabilitated and stuff. So those are the things we believe will be transformed by a journey platform. And think about the other areas which is already been commoditized, like diabetes. They call it the digital therapeutics. How do I manage diabetes sitting at my home? How do I manage my obesity? And how do I manage my allergy and things like that? So those are the things we are seeing. The condition management, mostly on the non-communicable disease side. There is a huge requirement for a digital platform where I can get care, ongoing care with the providers, mediated by a care team remotely. That we believe that will happen sooner, because it's already started happening in most developed economies, like including US, UK, but still in India we'll start seeing those kind of systems getting emerged. Okay. And monitoring. So again, think about the journey transition that can happen. Once I get rehabilitated, I may have a journey requirement to go back and start my activities, right? And think about even, the wellness side of it, right? Once I get back, I need to go back. I mean, to improve my quality of life, I may need to go back to my wellness state itself. I may need to do a few things. So eventually there will be a choice of journeys, and within few years we'll see seamlessly we'll be moving from different healthcare journeys. Okay, so that's our anticipation. That's what we believe, how health will be fundamentally transformed. Okay, so finally, just to recap before we get into questions, so this is how we believe it will unfold. This is our point of view, but there are a lot of interesting insights that's been emerging from the ecosystem on how health will get fundamentally transformed. Because it's incredibly complex, so many variables, so many old gods, so many new concepts and things like that, right? So the first thing will get transformed is care access. That's been already happening. We are already seeing the emergence of digital first companies, unbundled services like buying online pharmacy, diagnostics, consults, and things like that. And the rise of second opinion platform, even for oncology, for example. For cancer, now you can get a second opinion from global practitioners right from the home. So those are the things that's already been happening on the care access side. And other interesting notion is the hospital is getting unbundled layer by layer, because we built massive hospitals in India, and the state of the hospital systems in India, right? So there is a tremendous pressure to perform financially on most of these providers. Okay, but whenever that happens in another industry, what will happen is the unbundling slowly starts, because already you see, remember the last time that you bought drugs by walking into a hospital, because that's been unbundled already. Diagnostic, that's already happening, except inpatient settings, you use the diagnostics and pharmacy inside, but most of the time we use diagnostics outside nowadays, right? That is getting unbundled. And think about long-term condition management. You don't go to a super specialty hospital for your diabetes, or for your simple acute sit for fever and things like that, except a complex situation arises. That we believe is already started changing, because there are emerging sites of care, and those are the things that is getting unbundled, right? And also rebundling is also happening. The rise of specialty networks and things like that we already spoke about. And fully integrated journeys will emerge, because in future I'll have a choice. Okay, for example, I need to do my, like I said earlier, the knee replacement surgery. You will be able to pick the best based on the journey that I talked about, and then you'll recover well, and then you can go back to your own wellness journey. And we've seen people even starting to run back based on the emerging evidences and outcomes, right? There are some people who gone through surgeries and even started performing with their existing lifestyle. So those kind of things also we believe will happen, and also data flow will be seamless. Because we already missed that boat of EMR and EHR in India, because fundamentally, except few providers, the data doesn't even exist at all. Most of the big providers run a very good hospital information system, but it just stops there. We don't have much of clinical and wellness information. So with this unbundling and fully integrated journeys, we'll start seeing data flow will be seamless. And then will come the systems of engagement, where there will be continuous touch points with the patients, continuous monitoring and those kind of things, and making, people comply, get some outcomes, and those kind of things will happen. And then we believe fundamentally there will be an emergence of outcome orientation. Okay, if we skip any of these steps and directly try to talk about patient experience, patient centricity, outcomes, and those are the things we anticipate is not going to happen. So there are certain steps that we need to follow in terms of access, in terms of delivery, in terms of paying for care, in terms of outcomes, and those are the things that's going to happen in healthcare. And okay, so last is a shameless plug from our side. So we believe the future of health outcomes is a personalized journeys. Okay, so everyone is unique, everyone has a different goal, different baseline to start with, and set of interventions that will fit into my lifestyle, because some people follow just diet, some people need to work out and things like that. So also it needs to be personalized for each and everyone. And we believe that will be achieved by technology. Okay, so that's the end of it. So I think we are on time. So probably I think we'll open for questions and conversations.
Thanks so much, Vivek. Yes, that's correct. To all those who joined us today, please do share your questions if you have any. I already got a couple of questions from people regarding the deck. Many of you want Vivek's deck. So Vivek, a lot of takers there. We need to share that deck in that post session, and you will also get.
Sure.
I'll start with the first question from Ravi. So he says, so you talked about a lot of technology that's being used. So what sort of budget should hospitals keep aside for this?
Okay, that's a fantastic one. See, the consumption model on technology is also fundamentally changing. Okay, see, I'll give you LeadSquared as an example. Think about like 4 or 5 years back, you need to pay a bomb to get access to these kind of tech. But now there are partnerships emerging in terms of the digital players, right? Digital players working with hospitals on a consumption mode, which is workable for all of us. So there is no one precise answer, because it's talking about the different systems there. Because I could easily break the platform into multiple pieces. For the first piece is patient marketing. Okay, how do I even bring patients inside the hospital walls, right? So you need to have certain budget for that, and systems like LeadSquared give you an incredible consumption model. Second is the clinic automation. Okay, the simple things like appointments, the front desk automation, the outpatient automation, and those kind of things, right? That's the second piece to it. And the third piece on the practice management, your existing fitment into EMR, EHR, and stuff, and simple things like patient app, doctor app, care coordinator app, and things like that. See, it won't cost much now. Because if what I've heard, I don't know if it's true in the ecosystem, people used to say the IT budget of most Indian systems are around 1 to 2% of their total revenue. But this thing also doesn't need, that much of investment. There are like good consumption models. It may add few basis points on top of it, and then still you'll have an incredible patient engagement system. So it's again on case to case basis. I know fundamentally I couldn't completely answer in terms because it's again the answer depends depending on the hospital type, how many locations and how many clinicians and what type of areas that you're working on.
Right. Vivek, so now the next question's from Sanjay, and I think that would come into play here also. So Sanjay has asked, how can human fractal help? So Sanjay,
Okay.
also, can you share some more details about your hospital or clinic? As Sanjay said, as
Mhm.
Vivek said, how many hospitals or the scope of that. But Vivek, take it away. How can human fractal help?
Okay, so we have a division called Human Fractal Digital Therapeutics. Okay, so we in terms of deliverables, what we do first, we go analyze what kind of health system they are. Are they clinic? Are they a chain of clinics? Are they a hospital? And how many beds and things like that? And
Yeah,
what
yeah.
specialty they?
Sorry to interrupt you. So Sanjay said
Yeah.
they are a network of diagnostic centers.
Okay, awesome. Okay, so to disclose also, we also work with the diagnostic chain. See, for example, what is happening in a typical diagnostic chain now, right? We do a lot of health checks, but the health checks are, so how do you drive engagement between uh, health check number one to the health check that is going to happen in the next year? Okay, there is a brief period of time where patients will also think about shopping and things like that, right? So the step one that we work with your diagnostic chain is, okay, give me your say a diagnostic report. How do we fundamentally transform it to make sure it's engaging with the customers? Do people understand what a blood biomarker mean and what it does? uh, and how do I action and those kind of things we can build for our customers. Okay, in terms of app, the simplest experience that you can start with is people assume digitization of blood report is like a PDF in the mobile app. It's not actually. So you need to work with a systems-based integration from your LMS using technologies like using standards like Line. So people visualize their markers, and also you need to integrate consult into the whole thing. Okay, someone needs to help them action the data that comes out of a health check. Similarly, then once people start actioning, the engagement happens, then people will go for repeat diagnostics. Okay, because we've seen people in our network, the moment you say, okay, it's a simple thing like vitamin D, we all know we need to check, and we do a test, and we say, okay, I stand in the sun, or I okay take a dose of vitamin D and I just leave it that. But how do you create an engaging mechanism in a way that people do some intervention for vitamin D, and then they go for a retest, and those are the opportunities that been left out just like that. So those are the systems that we can build for a chain of diagnostic providers. Step one is the data transformation. Step two is deriving insights from your records, and step three is engaging with your customers. So we can build all these three systems for a player like a diagnostic chain. Like that.
Thank you. Sanjay, if you have any follow-up questions, please to put them forward. The next question is from Neetu. So she says, can you give any specific examples of hospitals leveraging technology really well today?
Okay, there are pockets of things happening in the ecosystem. One thing that we, from our perspective, we are really proud of is the post-discharge monitoring. Like I said earlier, in most of the hospitals, they all started with appointments well. Okay, but what happened is once during the fulfillment of appointment, again there was no technology. That's been enforced, right? But on a unbundled area like post-discharge care, I'll give you a simple perspective of a hospital. I just get discharged and I disappear, right? But there's a lot of revenue opportunity beyond a hospital wall, like my home care services, my drug fulfillment, and plus from patient perspective is also a win-win because I get tracked and then I give an opportunity again. I give a revenue opportunity for hospital, and then again a situation arises, I'll be in more inclined to a particular hospital. So those are the areas we are seeing hospitals started adopting. And also another important thing is the reconciliation area, the financial reconciliation between the insurance and the payments, right? Because there's a lot of cashless, a lot of modalities of payment and stuff. So these are the two areas we've seen providers are looking for tech. And the appointment side, that's been already commoditized. There are so many vendors who are built tech for appointments, and HAS. That's another area that's most of the Indian providers have good tech base layer. But you're seeing these are the new areas that you're seeing that technology deployment has been happening.
All right. So Sanjay actually wants to get connected with you, Vivek. So I shall share
Sure.
your contact details with Sanjay post session. I don't see
Sure.
any more questions coming in. So I will ask you, Vivek, if you can share any final tips or thoughts that you have for the audience today, and then we can close the session.
Nothing fresh from our side. I think it's been fantastic. I thank LeadSquared for the opportunity. And the audience looked great, and they had great questions. I really enjoyed the time. Yeah, thank you so much, guys.
Great. Thanks so much, Vivek, and thanks so much to the audience for attending the session today. We hope to do more such sessions specific to the healthcare sector, and hopefully you benefit from them. So thanks again. Those of you who asked for the webinar recording and deck, which a lot of you did, I will share that with you again very soon. Thanks so much, Vivek, for taking the time to do this for us.
Thank you.
Yeah,
No
and
problem at all. Thank you so much.
take care, everyone. I'll see you again sometime. Bye-bye.
Bye.